Chronic insomnia is a common complication of orthopedic injuries and medical conditions. Military veterans with insomnia secondary to a service-connected condition should understand the association, and I'll discuss that in this video. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Chronic insomnia is a very, very difficult problem, but there is some evidence that it could be and can be argued as secondary to orthopedic injuries. According to the 3rd edition International Classification of Sleep Disorders, insomnia characterized by difficulty in either initiating sleep, maintaining sleep continuity, or poor sleep quality. These symptoms occur despite the opportunity to sleep, the circumstances for sleep, and they result in dysfunction during the day. Chronic insomnia over a long period of time can adversely affect your health, your quality of life, academic performance. It can increase the risk of motor vehicle accidents, decrease productivity at work, can make you irritable, make you sleepy during the day. It's also thought to be and shown to be a contributing risk factor for a number of different medical problems like cardiovascular disease, chronic pain syndrome, depression, anxiety, obesity, diabetes, asthma, and a number of other things. Now, individuals who have difficulty to cope with a stressful situation, those who report being habitually light sleepers, have an elevated risk for chronic insomnia. There's also a high rate of association between insomnia, psychiatric disorders like depression or anxiety or post-traumatic stress disorder, other medical conditions, restless leg, chronic pain, gastroesophageal reflux disease, respiratory issues, immobility even have been shown to be associated with chronic insomnia. But as far as orthopedic injuries, yes, absolutely can be linked. One, the chronic pain that I've just discussed. There are studies that show risks of chronic insomnia due to chronic pain. The orthopedic injury, the bone or joint injury, ligament, whatever it is, leads to chronic pain that causes insomnia. It also can be such that positionally it makes it very hard to sleep. If it's a shoulder injury and you normally sleep on your side, if it's a back injury and you normally sleep in a way that now sleeping becomes uncomfortable for your back, makes sleeping hard short term, and then once that becomes a repetitive thing, can turn into long-term insomnia. It's not foolproof when it comes to a secondary argument or secondary condition for Nexus letter purposes, but I would argue that's very common. Most orthopedic surgeons would agree with that, albeit most orthopedic surgeons don't do Nexus letters, very few do. But having said that, most orthopedic surgeons would say yes, an orthopedic injury as it pertains to either chronic pain or positionally making sleep difficult can lead to chronic insomnia. I hope this was helpful. If you have thoughts on this, definitely let me know about that. Leave those in the comments below this video. Now, if you're interested in learning more about the disability claims process, you can get a free copy of my ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Those. Just click the link in the description below this video. You can get it absolutely free. Make sure to subscribe to this Veteran Nexus Letter channel. Click the bell to be notified when I release a new video and when I start my Veteran Nexus Letter live monthly shows. You get notified right away that I'm online. If you're interested in a Nexus letter for your injury or condition, click the link in the description below. You can learn more about working with me and working with my team. We do everything we can to make the process simple and quick, and I really try hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.